3 years ago, this small village in the Himalayan region of Jammu was distraught with grief. 11 children had died, their deaths linked to adulterated cough syrups. For this family, the news of a similar tragedy in the Gambia has brought back dark memories of their own loss. The parents had given their son a cough syrup bought from a local chemist. They later discovered it contained toxic chemicals. Ashok Kumar, a local teacher, is still fighting for justice for his son. He says he has lost faith in the system.
The culprits responsible for our children's deaths are still free. There was no action taken against them. We've all been crying for a long time. There are many other families who are also grieving for their children. If the government had taken timely action, they could have avoided this tragedy.
For decades, India's pharma industry has been hailed for bringing affordable drugs to the masses. But it's been rocked by the deaths of 70 Gambian children, linked to cough syrups produced by Indian drug company made in pharma. The incident has once again raised questions about the quality of drugs produced by India. A few kilometers away from Delhi, this research laboratory collects and analyzes samples for pharma companies. Manish Ranjan heads the testing lab. He says quality checks for drugs are vital for the safety of consumers.
Definitely, testing will improve the situation, and even regulators and the authority must have to recheck regarding the authenticity of the product.
Nukul Pasricha has long been concerned about the dangers of substandard drugs. His company, Pharma Secure, now checks the safety and authenticity of pharmaceuticals. And the situation is alarming. He says lax regulations in India's pharma industry has led to a huge rise in substandard and falsified medicines.
Incidents such as the one that happened in the Gambia, and even if we talk about incidents domestically like Jammu and Kashmir, have the potential to raise question marks that can cause reputational damage if not properly addressed in a thorough and transparent manner.
Back in Jammu, Ashok Kumar is meeting with other families who lost children due to toxic cough syrup. Clutching their children's death certificates, they discuss the future course of action in their struggle for justice.
The company that killed our children is still operational. It should be immediately shut down, and those responsible should be punished.
The latest scandal in Gambia is another setback for India's 42 billion euro drug-making industry, one that could tarnish its reputation as the pharmacy of the world.